Meet Mary. She's 78 years old and lives alone in the same home in Mineral Wells she has lived in for 30 years. Mary enjoys going to church on Sunday morning and Wednesday night and hosting her kids and grandkids a couple of times a month for family dinners. Mary's 2 grown children live about an hour away in the DFW Metroplex. After the passing of her husband a little over 2 years ago, Mary's health began to decline. She was suffering from depression and isolation. She stopped going to her primary care appointments and was not managing her medications for hypertension. As a result of declining self-care, Mary had 5 emergency department visits and 3 hospitalizations. Last year, Mary's service coordinator with XYZ MCO told her and her family about Complete Care from Outreach Health. With Complete Care, Mary receives not only Star Plus personal assistance services, but also enhanced care management, concierge services, home and health monitoring, and other support services as needed. All at no cost to Mary. Since Mary joined Outreach Complete Care, she is now able to manage her chronic condition and is excited about re-engaging in her community. Mary's family has peace of mind that their mother is safe and enjoying living independently. They are able to check in on her activity, thanks to non-invasive sensors in her home that monitors her activities of daily living, see real-time changes in condition thanks to advanced data analytics, and have a complete view of all medical history and care coordination between her providers. Last month, the Outreach Care team received an alert that Mary was at risk of a UTI. The float sensor in her toilet detected that she had used the restroom 7 times during the night and her activity in the house was less than normal that morning. Mary's Outreach Care navigator, Shelley, called Mary at 8:30 that morning to check on her. Mary confirmed that she did get up a lot in the night to use the restroom and was not feeling well this morning. While on the phone, Shelley coordinated to have a telemedicine visit with Mary's provider at 10 o'clock that morning. As soon as the appointment was scheduled, a snapshot of Mary's health trends over the last 60 days was automatically sent to the provider. Medications, vitals, physical activity summary, and any changes in condition that occurred since her last visit. Meanwhile, Mary's caregiver, Betty, received a notification about Mary's change in condition and of her telehealth appointment at 10 o'clock. All this information was also sent to Mary's daughter, Lisa, who was the designated contact. She confirmed that she would be joining the virtual appointment. Betty arrived at Mary's house at 9 a.m., prepared breakfast, and helped her get ready for the appointment. The telehealth visit resulted in confirmation that Mary had a UTI, prescribed antibiotics, and was encouraged to drink plenty of water. After the appointment, Betty went to the pharmacy to pick up Mary's prescription and water flavoring packs to help encourage more water consumption. She returns with the medications and goes over the doctor's instructions with Mary. Betty then prepares lunch and tidies up the house before leaving for the afternoon. Later that day, Miguel, Mary's evening caregiver, arrived to assist with dinner, laundry, and bathing. Prior to arriving for his shift, Miguel reviewed Mary's condition change and updated her care plan. He reports that Mary is feeling much better and is looking forward to seeing her family. The next morning, Shelley reviews Mary's activity and confirms everything is back to normal. Because of the quick identification of change in condition, intervention, and care coordination by the Outreach Care team, Mary was able to get the right care at the right time and avoided hospitalization, staying happy and healthy at home.